Well, welcome. My name is Angela Fishman. I'm a pelvic health physical therapist and owner of My Pelvic Therapy. And I'm super excited today to welcome Priya Rednam Waldo. Priya, thank you so much for joining us today. So, Priya is a licensed perinatal therapist and coach. And today we're going to be covering the challenges and strategies for navigating really the unmatched journey from going from being pregnant to being postpartum. So I'm really excited to have you here today, Priya. So thank you for joining us.
Thank you for having me. I look forward to our conversation.
So, first question is we talk a lot about birth plans, like, what's the baby prep going to be like? What's going to happen during the actual birth? But we don't sometimes think a lot about mom prep when we're going into having a baby. And either emotionally, physically, I know I work in the space of preparing the pelvic floor for mom before she goes in to have the baby. But why do you think we have kind of such a blind spot? I mean, women have babies every day. Like, why do we not think of mom ourselves as we go in to have a baby and go through this kind of perinatal period in our life?
I think you actually said it perfectly when you said women have babies every day. That ends up becoming, because it's such a common life experience to bring a baby into this world, we end up assuming that there's such a natural element of it that it doesn't need attention. It's so common, people do it all of the time. And so therefore, moms should just naturally adapt through all of the enormous changes that happen in pregnancy, but also in early motherhood, in that postpartum phase. And all of the messages we receive kind of reinforce that. Like your body will know what to do. Oh gosh, you're just going to take to it. You're going to instantly be a mom. So that's reinforced with us. And then all of the events, for example, the baby shower. There's a
Right.
focus on baby, right? All of the gifts are for baby. Everything is so oriented from the moment, really, that you see that positive pregnancy test. You yourself are so oriented to baby. But then what ends up happening is we really put ourselves on the back burner and we assume we don't need to really put any time or energy or attention onto our own wellness. Really, from a proactive standpoint, I mean, there's a lot of don't do this, don't do that, but there isn't a lot of emphasis on do this, or here are the ways to really prep yourself, mind, body, spirit, for this unmatched period of life.
I agree. I think a lot of the just thinking back to my own pregnancies, like a lot of the information that was kind of fed to me and was available to me was, okay, how to deal with maybe some of the discomforts of pregnancy, but not like who am I as a mom? Who am I going to be as a mom if it's my first baby? Who am I as a person in the workforce? Who am I in my relationships with my husband? Who am I, how my identity might even change as I go through that. There was none of that. It was like, okay, maybe do your breathing, maybe, very generic recommendations, but not a lot of prep for actually prepping my mind, body, and spirit for actually having the baby. I think you're so right that so much of that focus goes on to baby.
Absolutely. And I love the word you use, generic. It's very one size fits all.
Yeah.
Certainly, and even the healthcare, right? The biology aspect of it, it's very one size fits all. Most people don't know to engage with a pelvic floor therapist to get that really individualized support in preparation for baby or in postpartum. Similarly, most, myself included, have the cute apps, which I love, that are saying your baby's the size of a grapefruit, and here's what might be going on for you in your body, but certainly also in your mind as you change. But it's so broad, and it really doesn't honor the individual characteristics, strengths, challenges that each mother goes into parenthood with.
Right.
And so then we miss so many opportunities to really get personalized, high touch care, especially if we really only see a medical provider maybe once a month, right, in those early stages, and then once a week after that.
Well, and I think like when you said like week to week as you're pregnant, right? Towards the end, you're going so frequently to a healthcare provider. And again, it's so focused on baby. Of course, mom, the carrier of the baby. But I
Sure.
feel like I've had my own experience of this as well as many patients have talked to me about how after the baby comes, there's all these questions of what's normal and what's not,
Yeah.
and you don't know who to turn to. It doesn't make sense to go back to your primary care physician. The OB/GYN or midwife is generally more interested in how are you healing after the birth in general. But that might be one visit at 6 weeks post-op or post-delivery, you know? But what about all the other weeks and days that I have all these questions and what's normal and what am I supposed, where am I supposed to be at? And what are the guidelines for me to, or the guardrails to know if I do need personalized help?
Absolutely. I certainly remember after the birth of my first child, right? You're discharged from the hospital. And so the hospital ends their relationship with you. And yeah, there's a
Right.
pretty significant gap until that 6 week appointment. And so much of that 6 weeks is really all of it, I should say, is all brand new. What your
Right.
body is doing in the healing process, but also while you're simultaneously figuring that out, you're being expected to be very available to this brand new human being.
Right.
And we get very little guidance. And in my years and years of practice, both as a therapist and a coach, I've found that our OBs, who are wonderful in so many ways, they really are not confident in addressing the mental health issues that might be going on. Or they say, in the absence of an emergency, let's say physically, I'll see you at 6 weeks, but we don't really need to address these things before that. And so, so many moms, especially I work with a lot of high achieving, career driven moms, they're used to taking action when something feels off, but they're really being told, like, don't trust yourself. Don't trust that because if there was really an issue, we would have checked in with you earlier, right? That's the unsaid message. And so then they struggle in some really profound ways when they should be in a season of receiving support and having all of the joy and all of the wellness and fulfillment after moving mountains to bring their baby into this world.
Right. And let's talk about that a little bit too. Like if you're working with some high achieving mothers, what what's your most kind of common barrier that you see or how it manifests itself with high achieving moms versus maybe somebody that's not in that kind of pressure cooker situation?
Yeah, there's really a unique vulnerability that lies with high achievers because we're so used to getting the job done. We're running the boardrooms. We are, the head of our team in an ER, let's say, for a physician. We are an entrepreneur making things happen out of nothing. And so that is the identity that we're very proud of, but it's what people see, right? That is how we're perceived as someone who's got it together all of the time, right? And we see ourselves that way as well, typically, right? And maybe there's a little bit of ego in there, but we're
Yeah.
used to figuring things out. And those strengths that got us to that place, problem solving, having tenacity, being fearless, really maybe some strengths in analysis. We're very used to figuring it out on our own or leading others actually in figuring things out. We're not used to being on a receiving end. So what ends up happening for high achievers that I work with is they see their inability in this huge transformation that's happened, their inability to figure it out as a deficit. There's something wrong with me. I just need to keep trying. I need to figure something else out. My OB says I'm healthy. Like I got discharged from the hospital. I'm healthy. I'm really struggling, maybe in your field, right, to use the restroom, but I need to figure that out. Or in my field, right, I don't love hanging out with my baby. There must be something wrong with me. I feel really detached. Maybe they had a traumatic birth experience even.
Mm.
And so they're on their own. And what ends up happening is the longer they wait because they're used to figuring it out on their own, the harder it gets to engage in support. Within a very short period of time, especially with coaching, I'm able to develop strategies that are very personalized, very supportive and realistic for moms, and then they can see a turnaround. But so many are missed, and they end up silently struggling for a very, very long time, and they're deserving of not having that experience.
Well, and like two things as you were talking kind of popped into my mind. The first one is, do they see needing help as a weakness.
Mm, yes.
And does that prevent them maybe from reaching out sooner?
Yes. Yeah, absolutely. Especially kind of tying back to that first idea of being a mother is just something naturally by default you're great at and you love and they really conflate loving their baby with loving the experience. Like if I love my baby, then I must love staring into their eyes all day or breastfeeding 10 times, right, in a day minimum.
We could
Those
have a whole
early
other
days.
one on breastfeeding.
Right,
Yes.
exactly. And so I'm able to help them pull apart. Loving your baby is here. This other part, this is loving yourself and giving yourself space to heal from this enormous experience that you had of bringing a baby into this world and recognizing that, especially for first-time moms, none of us come with some guidebook, downloaded into our brain the minute our baby comes out. We all need support and we really need expert support. And
Right.
unfortunately, we are operating within a healthcare system and society that doesn't honor that enough. But I'm happy to be a part of closing that gap for moms. And what I work with is in particular in that pregnancy period, right? For those high achievers that see the value and recognize, yeah, let me get kind of my things in order before I even bring baby home, is helping them find trusted medical providers. Because so often in a time of desperation, we just hit Google, right? And we cross our fingers, but that feels exhausting, right? Instead, to say, oh, I've got all of my people in place and I'm proactively maybe setting up appointments or their partners in it with them and their partner knows, hey, my job is to set up some time with Angela as soon as you're able to go see her, right? That kind of preparation is invaluable, both from the practical side, but also in the security that provides you as a brand new mom moving into this season of life. You know, you've got your people already there, your village that's really there to support you, and they have expertise in all of these areas.